In the fast-paced world of healthcare, making the right decision at the right moment can save lives. But how do healthcare providers decide what to do first? Welcome to prioritization of care, an essential skill every healthcare provider must master. Prioritization means figuring out which client needs require immediate attention and which can safely wait. It ensures that urgent, life-threatening issues are addressed first, keeping our patients safe and well cared for. Effective prioritization isn't done in isolation. It's a partnership between the healthcare provider and the client, balancing safety, urgency, patient preferences, and both physical and psychological needs. Guidelines for prioritizing care. When setting priorities, we can classify them into 3 levels. High priority, life-threatening conditions like blocked airways or severe bleeding. Intermediate, important issues that aren't immediately life-threatening but need monitoring. And low priority, problems not directly linked to the client's current illness. One classic method for prioritization is the ABC rule: airway, breathing, circulation. Always ensure the airway is clear first. Apply CAB, compressions, airway, breathing, in CPR situations. Always pay close attention to vital signs and lab results, and act immediately when abnormalities are critical. Maslow's hierarchy of needs also guides us. Start with basic physiological needs like oxygen and nutrition before addressing emotional or social concerns. Golden rules of prioritization. There are some golden rules that guide our decisions. First, acute over chronic. Acute conditions, like sudden chest pain, always come before chronic issues like long-standing arthritis pain. Next, fresh post-operative cases, especially within the first 12 hours, take priority due to higher risks. Third, unstable over stable. An unstable client whose condition could quickly worsen needs immediate attention. And when in doubt, remember the tiebreaker rule. Prioritize by organ importance, starting with the brain, then lungs, heart, liver, kidneys, and pancreas. Stable versus unstable indicators. Let's dive deeper into stable and unstable patients. Stable patients may have chronic illnesses, be more than 12 hours post-surgery, be under local or regional anesthesia, have unchanged assessments, or present with expected and manageable symptoms. They might even be preparing for discharge. But unstable patients? These are our red flags. Think acute illness, post-op within 12 hours, or lab values that are critically abnormal, like potassium levels over 6 or a pH under 7. And some conditions are always critical, no matter what. These include hemorrhage, a dangerously high fever over 40 degrees Celsius, hypoglycemia, and, of course, any patient who is pulseless or breathless. Don't forget to consider time constraints and available resources. In disaster situations, priorities can shift fast, and quick action may be needed even before full assessment. And remember, always begin with assessment. Gather as much information as you can, unless it's an emergency, in which case, act swiftly. Prioritization of care is about making smart, safe, and compassionate decisions. By using these strategies, you'll not only manage your workload effectively, but also make a real difference in your patients' lives. Thanks for watching. If you found this helpful, like, share, and subscribe. For more medical academic insights, register on www.medoceo.com, the #1 medical e-learning and social platform.